The emergency department at Beloit Memorial Hospital is a very busy place. We're seeing almost 100 patients a day, which is a lot of patients to see in our current facility. Our job is to take care of patients as they present, whether it be sore throats, colds, or trauma, stroke, heart attack, whatever, in a timely fashion that's private and compassionate. And we're just not able to meet those goals in our mission because we're too crowded and don't have enough space to take care of the numbers of patients that we're being asked to see. It's not uncommon during busy periods to have 8 to 10, 15 people sometimes waiting in line out in triage, just waiting to check in, and it's not infrequent to have 6, 7, 8 ambulances at a time coming through the back door delivering additional patients. It's really time for us as a community and as a hospital to build a new emergency department so that we can meet these demands and provide the passionate and private and great care, which is our mission here at Beloit Memorial Hospital.
Dr. Barney is correct. Our current emergency room was built in 1990 and has served our patients well, but it was not built to handle the 35,000 patient visits that we will realize this year. That is why the expansion of our emergency room is so crucial. I would like you to see some of our plans to improve the efficiency of care in our new emergency room.
Hello, I'm Diane Eng. I've been a nurse in Beloit Memorial Hospital's emergency room for 14 years. I've also been a member of the planning team for our new ER. I'm happy to explain some of the facilities you'll be seeing on this virtual tour. We'll begin at the emergency room entrance. As you can see, we're adding a convenient new covered entrance for our patients. Patients will come through the entry doors into our spacious reception area. Just as they do now, patients will check in at the reception desk and will then go into one of 2 waiting areas, one for adults and one for children and their families. From the waiting areas, patients move into the triage area. Here a nurse asks the patient some questions about their health history, asks more questions about their symptoms, and then takes vital signs such as their temperature and blood pressure. Based on that information, patients with minor illnesses or injuries may be seen in our fast-track area where they can be treated quickly and allowed to return home. Patients with more severe symptoms will be seen directly, and the critically ill or injured patients who arrive by ambulance will be taken to our trauma area for immediate assessment. The fast-track and trauma areas will each have their own nurses station centrally located to the patient rooms. That placement will allow nurses and doctors to better monitor changes in a patient's condition as the diagnostic and treatment processes begin. We are adding 16 additional treatment rooms to the emergency department for a total of 27. Each treatment room will now be a separate private room and will be large enough to accommodate the patient, family members, the ER staff, and the necessary diagnostic and treatment equipment. Both the fast-track and trauma areas will have larger private patient rooms. Another new feature of the ER nurses stations will be separate areas for patient nutrition and medication preparation. The ER staff members are also very excited about having their own digital X-ray and CT scanning rooms within the emergency department. This location will give the ER doctors immediate access to test results and will allow us to be able to diagnose and treat patients more quickly, since we will not have to transport patients to other areas of the hospital for testing. The new ambulance bays will hold up to 6 ambulances at one time. Since our current bay holds only one ambulance, this change will be very welcome. We are also moving our helipad closer to the ambulance entrance for better patient access to our trauma rooms. These changes have all been thoughtfully designed to help us take better care of you. If and when you need us, we'll be here and we'll be ready.
Our goal is to build the most advanced emergency center available today. The citizens of the greater Beloit area deserve it.